Hello, and welcome to Addressing Health Literacy with Older Adults and Persons with Disabilities, our final event in our four-part webinar series on tips and tools for closing the digital divide. My name is Brittany Thomas, Associate Director of the Network of the National Library of Medicine, All of Us Community Engagement Center, and I will be your host for today's event. The network of the National Library of Medicine is proud to partner with Wisconsin Health Literacy, the Black Greek Letter Consortium, STEM Queens, the Latino Academy of Workforce Development, Milwaukee Public Library, LGBTQ Detroit, Generations Online, and the American Association on Health and Disability to offer this webinar series to learn more about health literacy insights, best practices, and available tools designed for meaningful and effective engagement with diverse populations. Before I introduce today's moderator, I'd like to review a few housekeeping items. This event is being offered through Zoom webinar, YouTube Live, and Facebook Live. Captioning is available. If you're watching this in Zoom webinar, you may access captioning in English and in Spanish via the links that are in the chat. In YouTube, you can turn on captions in English by clicking the CC button at the bottom of the video. To turn on captioning in English on Facebook, select the down arrow in the upper right corner of the page, select Settings and Privacy, then select Settings, select Videos in the left column, and then select the drop-down box next to Always Show Captions and choose On. Please message us through your platform's chat box if you need assistance finding captioning or if you have any other technical issues. We are also recording this presentation with closed captioning and will post the recording on NNLM's YouTube channel. We will also send out a recording of the panel to all event registrants within 1 week. Although you are muted, your participation is important for today's learning outcomes. Throughout the presentation, please use the chat box to post questions and comments. Our presenters will respond to as many questions as possible during our time together. Finally, at the close of today's program, you will be redirected to our online survey. Please take a few moments to share your feedback. For our NNLM members who are interested in Medical Library Association continuing education or the Consumer Health Information Specialization, you must first complete the online survey before receiving instructions for how to obtain credit for your participation. Now, with great pleasure, please allow me to introduce you to today's moderator. Caitlin Mowat is the project manager at Wisconsin Health Literacy. Caitlin has 9 years of experience in nonprofit organizations, including work in health literacy, healthcare communications, and community relations. At Wisconsin Health Literacy, Caitlin focuses on managing grant-funded projects on safe medication use, opioid pain medication, health insurance, and digital health literacy throughout the state of Wisconsin. Caitlin, thank you so much for joining us, and I will now pass it over to you.
Great, thank you, Britt, and thank you everyone for joining us today. We're going to open the floor for our next discussion as we welcome 3 guest speakers. They will share information about their organization and the communities they support, along with addressing tools and resources they found to be instrumental when talking about digital literacy and breaking down barriers to improve equitable access and use of online resources. Joining us first is Katie Burke. Katie is an administrator and project manager for Generations Online, or GOL. She has been with GOL for over 15 years. GOL is a national nonprofit with a mission of narrowing the digital divide for older adults. Prior to joining GOL, she was a market researcher for Chilton and Arbor research firms. Katie holds a master's degree in business administration from Villanova University. Her entire career has been overseeing the design, implementation, and successful completion of projects. She led the testing, piloting, and launch of the Generations Online sip and swipe digital learning cafes throughout the country. And I can say for myself, I had the pleasure of working with Katie on this project. Without further ado, I turn it over to Katie.
Thank you, Caitlin. Hi, everybody. I'm really grateful to be here today to give you some insight in working with seniors and digital literacy and digital health literacy. So the first thing is I want to just let you know that I want to help you, give you information so that you in turn can help your seniors flourish in this area. So if you think about it, older adults need to be online in order to access digital health information. So what I want to do is first look at the seniors that are like the statistics of who's online, and then deal with the seniors who aren't online and how you could best help them, and then seniors in general. So let's look at who's online. If you are age 64 or younger, your odds of being online are very good. May I have the next slide? Thank you. If your odds are very good if you're 64 or younger. You'll see I've circled the area. And Richard, next slide. Thank you. But if you move to the 65 plus age group, your odds decrease. You only go down to 75% online. And well, do you think, well, 75 sounds so good, right? Do you know that's 13.5 million older adults who are being left behind? If you add on top of that one or more other categories, like you live in a rural area, you're low income, you're a person of color, you're lower educated, you have disability, your odds of being online decrease even further. So let's first look at that area. So why are seniors not online? I mean, you'll hear that a lot. People go, well, I can't get my seniors interested. So there's three main reasons. The first is access, the second is skill, and the third is intimidation. And intimidation may not be what you're thinking of. It's often thought of as lack of interest. You may hear people say things like, oh, I've lived this long without it, I don't need it. Or if my family wants to get in touch with me, they can just pick up the phone. I don't need that stuff. Or the other one is often, everybody's looking down at those things all the time, so I don't want to be one of those people. That fits in with intimidation. But let's start with access. So what I want to do is give you some tools for your toolbox. So if a senior comes to you and is looking for information on access, that you can help them. So next slide, please. So I'm going to look at first if you're a low income senior and you're trying to get internet access at home, as in broadband internet access. I want to share with you three websites that I'd like to, or groups that I'd like to let you know about. The first is a nonprofit known as everyoneon.org. And what they provide is you can go to their website, and if you put in your zip code, it will tell you low cost internet plans in your area. So it simplifies it for you. The second is called Lifeline. And you may be familiar with this. If you're not, it was the old, people would call Obama phones way back when. It was a way to get access, but you can use the funding, I think it's at $9.95 a month. You can use it towards a cell phone, or you can use it for broadband access at home. The third is a brand new, it's opening up at the end of this month. It's a brand new benefit. It is a COVID related benefit. It's called Emergency Broadband Benefit. And what it's going to be is a benefit that will help people at home get either $50 per house, up to $50 per household towards their broadband, or if you live on a tribal land, up to $75. This will not be a forever benefit. It is funded under some COVID funding, so it'll last until the money runs out, or 6 months after the pandemic is declared over. But it's another way to share funding with people. Next slide, please. So the other, if they're not low income and they're looking for broadband internet access, what I would suggest, I don't feel comfortable recommending a site because they're for-profit organizations. So I would recommend you making a list of ones in your area that you could share with older adults so they have some resource, or if there's already a list. And I need my next slide, sorry. Let me see here. There you go. Okay. Oh, sorry. And there is another way to access the internet. It is through cellular. So if they have a cell phone, if they have their plan that they can access the internet that way, or they can purchase one through a cellular provider. There are also devices that come preloaded with the internet. I'm just suggesting this is one. I don't really know fully about it, but for example, it's called GrandPad. A lot of people have been using them lately with COVID. It's a closed system, so it comes set up with just like your family information entered in there. So it's a safe environment, and it comes, your package that you pay for has internet access already in it. The pros are that it's a safe environment. The negative part is, and it has internet access. The negative part is it has a monthly fee, and you have to buy their device. So the second barrier is skill. So I just wanted to provide you with some tips if you're looking for a way to help somebody with a PC or a laptop. Mousing is a big problem. So I really like this this group. They're the Palm Beach County Public Library, and they all have a mousing tutorial that's really cute and really fun. So if you share that with your seniors, they can practice with that. And there's also the game Solitaire is actually a great way to help somebody learn to practice using a mouse. If their skill that you're looking for is in the area of tablets or smartphones, that's something the nonprofit I am with provides. Is we provide free interactive tutorials that you can share with your older adults. You can run programming using it that it helps them walk through all the things from how to turn the device on to how do you scroll up and down. How do you get that keyboard to appear? How do you get it to disappear? So it goes through Gmail, texting, Skype, FaceTime, Zoom, all the video calling. There's no ads, no pop-ups. It is truly free. It's a great interactive tutorial. And so it's available for 3 types of devices. It's for Apple and Android for either a smartphone or for a tablet, and for Amazon Fire devices, a tablet. I'm going to show you 2 pages in our software because I want you to know no matter what you use. This is our first page, and it talks about how you go about tapping. And if a person's new to technology, just that first tap is a big deal. So if you can praise them for being able to do the tapping or the clicking, you don't need balloons from the ceiling, but something like, hey, look at you, you're entering technology. It's a good thing. So we praise them. The third barrier, and the other thing is respect. The barrier is intimidation, but a reason for intimidation is respect. So I think we need to know our audience. So if you get a little insight to some of these things, it helps you reach your seniors better. They're intimidated in that they're afraid to break this device. They're afraid of being financially responsible if they break this device, if they're using one of yours, right? So we have to reassure them. And just saying, oh, you won't break it, isn't reassuring, okay? That's just kind of fluffing it off. So explaining that it's built for this kind of pressing and things like that are what they need to hear. The other thing that you really kind of need to get your mindset in is what really happened for the senior to get behind, right? So the radio took 40 years before most people had it in their household. The television, 20 years. But if you took a nap when the internet came into being, next slide, boom, you missed the internet explosion. It was like 4 years before it's in everybody's house. And while you were taking a nap, everybody learned a new language. And little kids can speak it, and everybody speaks it, and you can't. So for example, www. We did a focus group, and we asked older adults, what did www mean? And one woman said, oh, honey, that means I'm never going to see it. That's what it meant to her. So things like YouTube, right? Social media, Twitter, tweeting, they're all words that we take for granted, but it's a foreign language. So if you really think about it, like somebody speaking a foreign language, it makes it easier to understand where a senior is coming from. So to help overcome their intimidation, if you do simple, easy to understand language, reassure them that they won't break the device, and make it fun. So when you're considering, there's great videos that were created under this grant that are really wonderful. But I want you to think about when you're offering programming to your seniors, who are you really trying to reach? So you need to consider, can you go back one slide? You need to consider who's going to benefit from yours. Should you have some screening or prerequisites? Because trying to be all-inclusive could backfire on you. So for example, I'm just going to look at one of the videos, which I think are wonderful if you know some technology. So it talks about internet email, and it explains it very well. It has great graphics, it's terrific. But it goes on, the next slide, the next wording says, if you own a smartphone, and then it goes, and if you already have an app, well, some seniors don't know that their phone's a smartphone, and they don't know what the word app is. And the next slide says, like, quickly the words are like, if you have an Apple ID, a Google username, or a Microsoft account, you may already have an email. So here I am, next slide, 32 seconds into the video, and I could be totally lost, right? So here you are trying to do this wonderful thing of helping people get an email account, and you've overwhelmed some seniors. So really just stop and think about who you're trying to reach. So if a senior's lost, what's going to happen? They're going to either kind of mess up your programming because they're going to be asking lots of questions, or they're going to be lost and not interested any longer. So just think about who you're trying to reach. I'm not saying to leave out the newbies. You got to start at another level for them. So keep it simple and have a goal. And when I say a goal, learning to use the technology, the device, is not the goal. That may be your goal. I want to teach seniors to use technology, but that's not going to entice your senior. So it's what will entice your seniors. So for example, during COVID, people wanted to attend online church services. They wanted to get together with their people from their community in maybe support groups or with their senior centers. So if you can teach them that, then you can lead them to the wonderful digital health literacy information. You can also encourage it by, if you have programming and you tie it in with that. It could be all different programming. But say you do a nutrition class. You could say, if you have an email account, you could sign up for these free email recipes. And if you don't have an email account, here's how you can go about getting one. We have a program if you know some technology, or if you don't know technology, we have another program. So it's a way to kind of reach all of them. And then for seniors, there's kind of for all of us, there's challenges. So 3 main challenges for older adults are visual, hearing, and cognitive. So for visual, 66% of all adults with vision issues are over 65. So you just want to take that into account when you're creating your plan. So if it's something you're writing or showcasing like this, you want to do contrast. You don't want to have soft pastel colors, people can't see them. Don't use glossy paper because the reflection from the lights can make it hard for older adults to see. And less text per page. The second is the hearing. Hearing loss, as you know, is a common issue. 33% of all adults 60 and over have some hearing loss, and 50% of those 85 and over have hearing loss. So you want to try to limit background noises, speak clearly and face them. Try not to speak as you're facing the whiteboard. Just speak first and then write it on the whiteboard. And also, don't assume that people have hearing loss. So don't suddenly start speaking really loudly to every senior because they don't all. So look for cues as to what you need to do. And the third one is cognitive. So we have a greater reduced processing speed. We take a little longer, a tendency to be distracted, and reduced capacity to remember the information. So all you have to do is make it clear and simple for us, be repetitive and not in a very polite way. So maybe you offer 2 ways of saying the same thing. You can give handouts that support what you are using. Or for example, if you were using our tutorial, the one for tablets and smartphones, you leave it on their device and they're able to go back and use it again and again and again. Because we all do that. You take a class, you think you know it, and then you leave and you forget everything they said. So be repetitive. I also want to make sure that you are just aware that there are accessibility features on all devices. And all you need to do is Google. So like Google, or use a search engine, but Google for accessibility for font size for a Samsung device, tablet, and it will walk you step by step. But if they come and they say, I can't see my size, and I'm not talking about real disabilities, my colleagues will, my co-hosts will cover some of that, but I'm just saying, if it's just something that you just need to increase that font size. Like I have mine larger, my children tease that they can see it across the room for my font on my phone. And little things like having things like a stylist around. If you're teaching, if you're going through teaching touch screens or working with touch screens, instead of it being an issue that someone can't touch, if they have arthritis, long nails, things like that can get in the way. If you just have a few of these around, you can say, oh, try this, and it makes it not a big deal. They are really inexpensive and they can have a huge impact on your seniors. You can buy them at the dollar store, you can buy them in bulk on Amazon. So however you want to get them, but they are a really good thing to have around. The other thing you want to think of is your environment. So if there's glare on your environment, on your device, or on whatever you're trying to help them learn their digital health information on, that can create a problem. So if you're using tablets or smartphones, just have a few stands around. So if they come in without a stand for themselves, you can have one. I mean, I have one here. They're not, they don't have to be a big deal. This is for a tablet. You would open it up and just clip a tablet in it. So you can have a few. If you're handy, you can go to Pinterest and make it out of cardboard, but I am not. And I want to just, in the next slide, this lady always chokes me up. This woman is Mrs. Robinson. She learned how to use a computer at the age of 99. So don't let anybody tell you they're too old. She is proof that the importance of being able to access digital health information. She developed aphasia, and in my layman's terms, it was like that she got it in her brain, but she could not get the words out her mouth of what she was trying to say. The doctors could not make her understand what was wrong with her. So she wrote us and said, thank you for having this tutorial to teach me, because I couldn't understand what was wrong with me. And I came on my computer and I looked it up and I figured it out. So I want you to know technology saved me where the doctors could not get the information across to me. So don't let anybody tell you they're too old, okay? So get them to that health information. So my contact information is here. Generations Online or tutorials are all free. If there's anything I can do to assist or let you know more information about our program, I'm happy to help in any way. Thank you for your time, and I appreciate the work you're doing for your seniors. I'm going to turn it back over to Caitlin.
Thank you, Katie. And thank you for addressing the barriers senior populations face. You really hit on a great point that tools and resources can't be applied as a one-size-fits-all approach. This has been talked about throughout the virtual series program, and something just to really remember as you consider implementing programs and projects for your communities. And next, we have the pleasure of 2 speakers joining us from the American Association on Health and Disability. Carl Cooper is the Director of Public Health Programs at the American Association on Health and Disability, or AAHD. Carl has spent most of his professional career addressing the needs of individuals with disabilities. Since October of 2013, he has been at AAHD as a project manager for the National Disability Navigator Resource Collaborative. Before that, he was a policy assistant at the National Disability Rights Network and a policy associate at the National Association of States United for Aging and Disabilities in Washington, D.C. Prior to moving to D.C. in 2012, he practiced law for 14 years in the greater Philadelphia area, opening his own firm in 2006, where he was able to devote time to pro bono advocacy for those affected by physical and developmental disabilities. As part of that work, he helped consumers navigate the opportunities available in employment and education, drawing on his own personal experiences as a person with physical disabilities. Also joining us from AAHD is Anthony Oberg. Anthony, project associate with AAHD, has been at the association for a little over a year now. He started 3 days before the office closed due to COVID. He is a person with a disability and uses a manual wheelchair, so he is personally invested in accessibility issues. Professionally, he has experience in document accessibility, which informs how he approaches his work with AAHD. Mr. Oberg lives in the DC metro area and serves as the vice chair of the Bus and Rail Subcommittee for the Public Transit Accessibility Advisory Committee. And with that, I turn it over to Carl and Anthony. Thank you for joining us.
Thank you very much, Caitlin. As Caitlin said, my name is Carl Cooper. I'm with AAHD. We are a national cross-disability organization located just outside Washington, D.C. in Rockville, Maryland. Our stated mission is to promote health and wellness for people with disabilities. And we do that through 5 main objectives that we work on. We work to reduce health disparities. We advocate for community inclusion. We promote full accessibility. We integrate disability into the public health agenda, and we work to advance knowledge translation and disability research. In terms of our organization itself, it's made up mainly of disability researchers as well as policymakers and people with disabilities themselves. Before we talk about exactly how to help people with disabilities in the digital setting, though, we thought it would be a good idea to sort of take a look at exactly who people with disabilities are and knowing some of the basic facts about them, especially as it relates to understanding the importance of exactly who you're dealing with and the health disparities that they face. So we do want to take a look at some important statistics as it relates to health disparities. Now, a common question I get, since my background is a legal background, is, well, how do you define disability? And the answer to this is it's not an easy answer. There's multiple definitions for disability in federal statutes. So there's a lot of different ways you can break this down. You may hear the statistic that 1 in 5 individuals has a disability. And in that instance, it's true that, that's the broadest definition of disability as you'd find it under the Americans with Disabilities Act. Then there's other statutes that define disability very narrowly, depending on what they're looking for. So for instance, the Social Security Disability Act defines it very narrow, but that makes sense because you don't want just anyone having access to Social Security disability. So in that instance, it's a much more narrow definition. For the purposes of the statistics I'm about to provide, we're talking about something that's sort of in between those two definitions. So in this instance, we're talking about someone that has a disability which seriously limits them. And in this instance, HHS indicates that there's about 12.5% of the population that has a disability that fits within this category. So that's it is 1 in 8 individuals has a disability which seriously limits them. And for this population, these people with disabilities are over twice as likely not to see a doctor due to cost. They're over 30% more likely to be obese. They're 60% more likely to smoke, and they're over 2.5 times more likely to develop diabetes. There's also other important statistics with this related to prevention. So for instance, women with a disability are less likely to have a current mammogram, and they're also less likely to have a current Pap test. People with disabilities are also 3.5 times more likely to have cardiovascular disease in the 18 to 44 age group. If you go one age group up, this is 45 to 64 age group, it gets a little bit better. It's just under 3 times more likely, but they still are more likely to have cardiovascular disease. And that, of course, is not because the people with disabilities are getting healthier. It has to do with the fact that people without are getting less healthy and are developing cardiovascular disease. So that's why it narrows a little. In terms of social determinants of health, people with disabilities are they have double the unemployment rate among those within the workforce, and that's a key point that to make there. It's those within the workforce, not talking about people that are unable to work. So people that are able to work, they still track about double the unemployment rate, and that's regardless of what's happening with the economy. So if the economy is very good and unemployment rate is like 4%, then people with disabilities, it's generally about 8%. If there's a recession and the unemployment rate goes up to 10%, then people with disabilities, it's going to be closer to 20%. So it tracks regardless of what's happening with the economy. Generally, people with disabilities are double the rate of the unemployment rate that you see. About 35% are more likely to have less than a high school education, and people with disabilities generally are less likely to report sufficient social and emotional support around them. Now, this next chart on the next slide, I do want to really take a little bit of time, especially given what Katie was talking about, because this is a very important chart to really explain the disability community and how people come into disability. And this particular graph shows the percentage of people with disabilities based on different age ranges. So you see the youngest age range of 18 to 24, it's 6.1% of the population has one of these significant disabilities. So it's a low number in terms of the percentage. And then you can see basically the percentage continues to go up as people's ages go up. So these, by the way, these are statistics from 2010. This was done some research done by HHS and published in an article that is noted on the bottom of this screen. But the real important takeaway from this graph is this. You'll see that the percentage, as people get much older, as Katie was talking about, they develop certain disabilities as they go into the senior status. So you can see once you get into the 65 to 74 age range, you're almost at 30% of the people have some sort of significant disability. And generally, it's a mobility disability, it's vision, it's hearing, it's cognitive, it's all those different ones. But those types of individuals are going to view their disability very differently than people that have had a disability their whole life. So for instance, for myself and for Anthony, we had disabilities since childhood. We've learned to adapt. We understand what accommodations are available to us. This is also especially true when you're talking about people that have vision and hearing disabilities. Those folks that are born deaf or they are born blind, they understand what accommodations are available to them. Whereas people that lose their sight or lose their hearing as they get older, lots of times they have more of a fatalistic view of things, and they're more like, well, that's just what happens when you get old. And they may not realize that there are accommodations available to them that can make them interact with a program. And that's very important when you're dealing with these different population groups. Is someone that's had that disability their whole life will understand that there are accommodations available versus others that are older may not, and you may have to do some education for those individuals. So what exactly does outreach to the disability community look like? And disability messaging is a very important thing that we do. This program grew out of this whole video series has grown out of the All of Us research program. So I'm going to use that as an example of some of the work that we've done in disability messaging. So the All of Us materials that you see on the slide now are images that we are documents that we have used in our outreach. And we think it's very important that people understand, people with disabilities understand when you're doing outreach that they see themselves in the imaging. If they see themselves in the imaging, they're going to realize this program's for me. So you want to include imaging that includes people with disabilities. And we've worked with the program to really make this even be broader. So for instance, for Anthony and I, it's great because people automatically think if you're going to show imaging that includes disability, then we'll put someone in a wheelchair. That'll be the image that we'll use. Well, guess what? That doesn't always translate to what is going to necessarily be what you need. You need to have other imaging that includes other disabilities, so that people understand that it's broader than just people in wheelchairs. So showing someone with a hearing aid, showing someone that's using sign language, or in the image, if I could have the slide back, the imaging that shows, for instance, that we had them add imaging that includes someone with using a guide cane to indicate visual disabilities. And we also work with them specifically about having racial diversity among the disability imaging as well, that it's not just white people that have disabilities. Disability cross-cuts across all ranges of ethnicity. It cuts across all ages, so the imaging then needs to reflect that as well. And some of the things that in terms of what resonates with the disability community when you're talking about trying to get them involved, they want to know that everyone's invited. They want to know that in the case of the All of Us research program, that treatments are available for their disability, that better care is available for secondary conditions for those with their disability. Because lots of times, I know my disability, my underlying condition is not going to be solved, but what can you do to help me address my secondary conditions? I have mobility issues. So what can you do to help me be more active and get some physical activity given my limitations? How can you do something that's going to allow me to be involved? And then also, the final point on that slide is getting researchers to consider the disability as a variable, understanding that disability is just one part of who we are as individuals. It's an important part, but it's not the only thing that we have and the only thing that we deal with. So there is some basic issues that we talk about with disability accessibility and etiquette. So we want to go over some of those. Some of them are very basic things that you may be thinking about when you're hosting an event, a live event, when we go back to those. Some of the things that you want to think about is, parking lot accessibility, making sure that there's spots for people who use those and that they are free and clear of obstructions. That the building is accessible. We always say that, newer buildings that are built accessible, but lots of times when becomes a lived-in environment, it doesn't become usable anymore. So that the accessibility, usability issue, it becomes something, a room is built to spec, but once you start putting things in it, it can become inaccessible very quickly. Making sure that elevators and ramps are clearly marked so people know where to get to them. Making sure if you're setting up a room for a meeting, that it's done so in a way that allows people with wheelchairs to get around the room and not just sit in the back. Making sure that people that have hearing disabilities and maybe need to be towards the front if you're using an ASL interpreter, that those seats are clearly marked so they know where to go. All those kind of things are important things when you're setting up a meeting room. Making sure that the restrooms are accessible and that the accessible stalls are free from obstructions. Having things available in alternative formats. Katie talked about this a little bit as well in terms of having some of those things that are available that are going to be able to be used by those individuals that maybe have visual disabilities or vision disabilities. And that includes the font size on there. So if you want to have things that are large text, then you want to make sure that it meets the standard. The standard for large text is 18-point font or larger. The minimum should be 18 points. So if you're doing something that you want to say is large print, that should be the font. If you want to have what we generally do when we're out doing public events is we will have two versions of the same document if someone wants a large text, because lots of times if you're doing a one-pager, you want to keep the font a little smaller so it's 12-point or something, but then ultimately you should have that other version of it that maybe is a few pages to get all the material, get all the information in there, but then it's in the larger font size that you can give to people that require large font. And we know now that we're also living in a virtual world. So how do we navigate that virtual world that has existed now for over a year? And it's really caused some new challenges when you're talking about events. So people that are using wheelchairs, guess what? A lot of their problems don't exist anymore, but it does create new problems for people that have vision or hearing disabilities. And making sure that you're doing things that are going to be able to still reach that audience, and making sure that you're doing things in a way that's fully accessible. So having alternative formats for printed materials is a key way to do that. Allowing for alternative means of participation. Maybe having something that's going to allow someone to participate in it in a different way. And that includes also when you're doing a Zoom meeting and you're sharing a screen. Screen readers are very good about interacting with different things, and they can interact with the chat function in Zoom, but it will not tell the person with a vision disability what is on the screen if someone is sharing their screen. So maybe making sure that you have that alternative mean of participation, which is maybe sending a slide deck out ahead of time to people that need it to use with a screen reader, because then they can follow along separately and they're able to do that. Including alt text in online images is a key one. If you're doing anything on a website, making sure that alt text is there. Screen readers pick that up and will read to the individual using the screen reader what the image is. It's especially important if it's something with important information. If it's a graph or something like that that conveys information, you want to make sure that the alt text is there so that the folks can interact with that. And then, just like I said, making Zoom accessible is an important part of it, and especially having captions available. There are easy ways to do it. You can certainly have an ASL interpreter be one of the people that attend your Zoom event, and they can ultimately interact and have, and provide ASL interpretation. And then the person with that needs that can pin that video so that they can see it clearly. But there are minimum standards you can also do as well. ASL is probably the best practice, but there's also other things you can do. For instance, providing closed captioning. Zoom has really increased its ability in terms of the automated captioning, and it's very easy to turn that on. So if you look at what I had here, it's a screenshot from Zoom settings. And there's two things you need to do to make sure that captioning is set up so that the automated captioning is available. You see on the slide, in Meeting Advanced, there's an option for closed captioning. You need to make sure that that's turned on. And then you need to have the box check that says Enable Live Transcription. And then that gives you a couple options. If you can go to the next slide, please. Then what you can do then is when you get into a room, you can, as a host, you will have an option that says Live Transcript. And you can click on that and you can see now the menu that pops up then. And you can assign a participant to do the captioning, and you can have someone actually do it. You can type it yourself, or you can have a third party work with you, and you can have someone that you pay that does it on a third service. And there's a token that you can get that you copy and you provide it to them, and then they can come and join your Zoom and provide the captioning. And then the final option is the live transcript that I'm talking about. And you have to have this. That's where you have to have that blue check, that blue box check marked that you saw on the prior slide, and that will allow you then to enable auto transcription so that the AI that Zoom uses will automatically do that. And then we found that it's really increased its capabilities. Zoom has really increased the capabilities. It's still not perfectly accurate. And ASL and having a live captioner is still the better way to go. But it does capture a lot of what's being said. It does struggle with some acronyms and stuff like that. If someone has a heavy accent, sometimes it struggles. But it does provide some basic transcription for you. And then if you're doing something after the fact and you're recording it, it does give you a transcript then you can work off of, and then you can go back and re-edit it so that if you're putting it on YouTube or something later on, it does allow you to do that. So going back to this next slide then, so that's how you do captioners. But like I said, also then for ASL interpreters is the preferred way to go. And then you can also do screen sharing and making sure that you're doing that in a way that's accessible. If you're not able to send out something ahead of time, then making sure you're describing what's on there for people that may use screen readers and understanding that. And then, of course, we have that note at the end. Whatever you do, be flexible with it, making sure that you're able to adapt, asking people what their accommodation needs are ahead of time so that you're able to anticipate exactly what it is that people need. And that will then allow you to sort of navigate that area. So from a digital accessibility standpoint, then that's very important in what you can do. When we go on, we do talk about some of the things that we can do from a virtual presentation and making that fully accessible. And we have on here some pre-presentation tips. And I'm not going to take the time to read through all of these, but I do want to sort of point out some important things that are on here. So, we went through some of the things to make sure that things are checked on. and that all your settings are set up ahead of time, and understanding what those are. That's a key part of what you need to do ahead of time. If you don't have those boxes checked for the auto transcript, once you get into the event, it's going to be too late, and you're not going to be able to do it at that point. And then you can also have you can tag team things and identify a person that's going to sort of monitor your chat, so that if questions come in on the chat, they can do that. What that person can also do is serve as sort of someone that can sort of describe things if there is something that someone's sharing a screen that you want to have put in the chat, as a way to sort of mirror that. For instance, we've done events where we've used the whiteboard feature in Zoom, and then we have a separate person that whatever's going on the whiteboard is also typing those responses in the chat, and that way a screen reader will pick that up. It will not pick up what's on the whiteboard, but it will pick up what's going on in the chat. So just sort of mirroring it in both places is a good way to do that. So if you identify the person that's going to do that ahead of time, that's a vital role that they can play. And then always trying to record things, making sure that you're setting it up to record things whenever possible. It allows participants then that need to go back, maybe if they have cognitive or intellectual disabilities, it may allow them to review things and then take it more slowly if they need to do that, and take it in their own time as well. And then when you're actually doing the presentation, one of the things, a lot of times if you're doing a webinar or something like that, we do checks, ahead of time. Before we did this presentation today, we all got on early to make sure everything was working. Add an access check on your checklist of things that you're doing, and making sure that people are going to be meeting what you need in terms of some of those accessibility issues. Making sure that if you're using an ASL interpreter, making sure that they can hear everything clearly, providing them notes ahead of time. I'm not very good at this, but making sure you're not speaking too quickly. I know I am someone who talks very quickly, so that's not always something that I follow, but I try to make sure I'm going at a pace where an interpreter is able to keep up. Establish some basic ground rules when you're in the presentation, letting people know what accessibility functions are available to them, letting them know to add things to the chat if they've got questions. Tell them about using a react button if that's a good way for them to interact, if they can't, if typing is more of a challenge for them. Maybe those icons that you can have available in the reaction icons are what would allow them to do that. And then some of the other things that you can do is let people know about if they captions, and the fact that actually the user can then go in and change the size of the captioning and all that kind of stuff. So if they need it bigger, they can do that. Making sure that people, when they're actually speaking, are identifying themselves so that people know who's talking at any one time, especially if someone has a vision disability. They may not recognize, they might hear a different voice but not know who it is, and making sure that people are identifying themselves as they're speaking. Making sure that you're describing images that are on the slide. If like for instance, when we had that chart earlier, sort of walking people through it so that they understood exactly what was on the chart and the important part of that. You'll notice when I did that slide, I didn't read every single specific percentage, but what I did do was get across the main point, which was what I was using that slide for, and talking about how the percentage increases with age. And then in terms of, we talked about large text fonts being 18-point font. For a presentation, it's 24-point font in PowerPoint. So when you're doing a PowerPoint slide, 24-point font should be the minimum size that you're using. Otherwise, it gets too small, and it's really gets difficult for some people to see it in a presentation mode. And then if the meeting is being transcribed, making sure that the transcripts are available afterwards, once again, for those people that may want to follow up if they have a hard time following along at the pace of whatever the meeting was that you were going through. And if I could have, actually, you know what, let's go to the end. There's more slides in this slide deck that talk about disability etiquette. Because of the time involved in this presentation, I don't have the time to go through all of these. But if we can go to the end of my slide deck where we talk about the resources that are available, I want to point out a couple of important ones. Number one, the disability etiquette slides that I talk about, a lot of those are touched on this disability etiquette fact sheet that you'll see linked on this slide. We also have a page where we talk about a lot of different, on our website, that talks about a lot of different tips and stuff like that in terms of what you can do. The virtual platform accessibility tip sheet, those 2 slides that I just went through before, that can be found on this page, and I would encourage you to go ahead and check that out and download that document to help provide a checklist for some of that stuff. It also has the etiquette sheet. You can find that there as well, along with, you know, what you need to do to engage the disability community and develop partnerships with them as well. And then if you're doing, we have a self-assessment guide for facilities. If you're doing in-person events again, this is specifically designed for medical facilities, but it also does have some, there's some important things in there that may also work with offices and stuff like that. So you may want to check that out as well. So at this point, we'll go ahead and turn it back to Caitlin, and we're, I think at this point, ready to do some Q&A.
Yes, thank you, Carl. You shared a lot of great resources and guidance. We are going to open up the discussion for questions and group discussion. Before I do that, though, I want to go back to what has been highlighted throughout this week, and not taking a one-size-fits-all approach for the program development and implementation among different communities. And you both organizations shared a lot of great resources and guidance for this implementation. But I want to focus more on how we bring the audience to the table and to help in the developmental process. And Carl, you mentioned this in the visuals you shared, and including diversity in age, race, and you know, abilities, and all over the board. Just don't consider just one thing. What are good ways? And I open up to either Katie, Carl, Anthony, whoever would like to take this first question. What are good ways to recruit community members in this developmental process? Maybe share some examples of best practices for connecting in your communities.
Sure. There's a saying in the disability community, nothing about us without us. And, you know, making sure that you're involving people with disabilities early on in your planning and programming is ideal. One local resource that everyone should have near them is what's referred to as a Center for Independent Living. They are all across the country, and they work with people with disabilities. That's what they do. So I would encourage you to find your local Center for Independent Living, and you can partner with them, and they will be able to be a great resource to help provide some basic information as to what they need, what people need to be thinking about. And then they'll also be able to help with recruitment of people with disabilities as well.
Yes, thank you. And did anyone else, Katie or Anthony, want to add anything to that?
Well,
Just
go ahead, Anthony.
okay. Sorry, this is Anthony. We're over talking each other. I would just say that I think the through line for what we've been talking about is, you know, for either community, for the disability community or any other, it's not enough to sort of have the information. People need to be able to access that information, and I think that's the biggest sort of strength to don't let one size fit all. I know Carl mentioned the stills, but one thing that I always think about as a person with a disability is I only know myself. I'm the one who knows myself the best. And so even other people with disabilities, right, I'm not going to be able to speak for the rest of them. And so that's really the most important thing. And I think just to add on what Carl was saying, like if you reach out to a disability organization like ASIL, you will get a wide variety of people that will think of things, like even another person who uses a manual wheelchair like myself is going to think of more things that they need as an individual than I could think of and give you myself. So
Thank you so much. And we have a lot of questions coming in, and so we'll jump to the next question here. What are some suggestions for ways for private health systems can partner with public libraries to aid in this effort?
Well, thinking of seniors, I know, you know, just getting seniors online or so they can access their health records, be able to do telemedicine is huge to the other party, right? So that if they can provide some devices, maybe it's tablets for a local senior center, local library, to be able to offer programming that they can run workshops on how to use these health literacy tools, or basics would be a great win-win for both sides.
Yes, absolutely. Thank you for sharing that. Just going through some more questions here. Many seniors, Katie, to follow up with that, refuse to use computers and cell phones. Is there an alternative way for providing paper materials, surveys for them to read and to mail back? How do we manage paper reduction while providing alternatives to using computers?
Good question, but I don't have a magic answer for that one. As I said, intimidation is a big thing, but if someone absolutely positively refuses, we still have to be inclusive. So I think paper still remains. And I don't think there's an easy way to get it back unless they'll use some form of technology.
Yeah, it's important to still keep that around. We can't forget about it. We have a couple more questions here coming in. How to work with non-verbal patrons on ASD spectrum. So if either of you want to take that on what is the best way to work with non-verbal patrons on ASD spectrum?
Yeah, that's a great question, and the autistic community is one that you've got to. The best thing to do is to meet them where they are. Is the easiest way to say it. And if you're talking about folks, especially who are nonverbal, and if we're talking about digital stuff, then see if they are comfortable with doing email. Email might be the best way to reach them. And you may want to interact with them in a different way than what you are going to interact with other folks, but just understanding what their needs are and what their preferred method of communication is the way you can be the most respectful of them. So I think that's the easiest takeaway from that, is just trying to establish early on what their expectations are and trying to meet that.
Absolutely. That's wonderful. Thank you for sharing that, Carl. And are there free services to provide ASL interpreters similar to phone relay services? Does anyone have insight if there are free services?
I am not aware of any free services for ASL interpreters. I do know that one of the things that I often talk about, that in terms of what we need to be thinking about when you come to ASL interpreters, is think about it as a language. It really is its own language. And just as you may hire someone on your staff that speaks Spanish, think about hiring someone that knows ASL so that they can address the needs of those folks with disabilities that require ASL. So that's one of the recommendations I could make, is trying to hire people like that. Video relay service is always available, and that is free for people who don't know what that is. That's how people who are deaf communicate over the phone, and that is a free service that's provided to them. So that's always a way that if you want to try and communicate with them, you could do it that way, especially if they're comfortable with it and familiar with it.
Great, thank you for sharing that, Carl. We are at 1 minute left in the program, so I do want to wrap it up and turn it over to Britt for closing remarks. And thank you all again for joining us, and to our fabulous presenters today. We really appreciate your time. So to you, Britt.
Yeah.
Caitlin, thank you for moderating today's event. Katie, Carl, and Anthony, thank you for presenting on addressing health literacy with older adults and persons with disabilities. I learned so much today. I'm just really excited to take it all back to my work and really kind of make our engagement better for both older adults and persons with disabilities. To all of our audience members, we want to thank you for attending this presentation, the final event in our 4-part webinar series on tips and tools for closing the digital divide. We hope you enjoyed this series and will walk away with new ideas to help address the digital divide for your communities. All of the recordings in the series will be captioned and made available for viewing on the NNLM YouTube page within the next week. This program was made possible in partnership with the National Library of Medicine, the network of the National Library of Medicine, and the National Institutes of Health All of Us Research Program. Before you go, we welcome your feedback on this program. A survey link is available to you in the chat, and your responses will help us continually improve our programming. Thank you.